Welcome back to Thrani, I'm Joe B. Today I'll show you a simple muscle energy technique that will hopefully unlock a stuck elevated first rib. It's pretty simple. Let's dive in. An elevated first rib is when the first rib is stuck superiorly than the opposite side rib. The cause of this can be due to a scalene tightness on the same side or a T1 side bending dysfunction towards the opposite side. For instance, if the anterior and middle scalenes are tight on the left, then the first rib on the left will be elevated, which can block the above C7 vertebrae from rotating towards the opposite side. An elevated first rib can bring about a headache that follows the shape of the ear. There's also a limitation of side bending and rotation opposite the headache side. And finally, there is also tightness of the neck and upper back. The assessment for a left elevated first rib requires the patient to do a cervical rotation and side bending test. The patient is in a short sitting with arms at sides and feet flat on the floor. The therapist is behind the patient with the low hand under the mandible and the top hand on the occiput. The neck is passively rotated as far as tolerated to the right, then side bent as far as tolerated, and the movement is compared to the left. Normal findings are that the neck ranges for rotation and side bending on both sides are equal. Abnormal findings will be that the left elevated first rib will result to limited right rotation and left side bending. If the right is elevated, then left rotation will be limited. When you have a left elevated first rib, the objective is for the rib to be depressed through a combination of a muscle energy and non-thrust techniques. The patient will be in short sitting with right arm draped over the therapist's right thigh or the treatment table. The therapist is behind the patient with the right hand and forearm controlling the patient's head. The left index and middle finger is on the posterior shaft of the first rib, anterior of the upper trapezius muscle. With the right hand, the therapist passively side bends the neck and rotates it to the left to unload T1 and the first rib. The left hand then provides an inferior force to the posterior shaft of the first rib, while the patient side bends to the right against resistance. This is held for 6 seconds for 5 reps, trying to gain more range to left rotation and side bending each time. For the exercises, you can do seated right side bending and left rotation for 2 sets of 10 reps, and then progress to scalene stretches and hold it for 3 reps for 30 seconds. So do you want to know how to correct an anterior rib? If so, then watch this next video. Thank you so much. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Thrani.